I have gone through security checks because I couldn't log into my account, even though it's my account, and I'm in. I believe I'm in. So evening all, it's the 7 o'clock Q&A that happens at 7 o'clock on Tuesday night, and it's happening now. So this is real. If you've got any Qs, I got the As. If you haven't, I've got both Qs and As. So all welcome here. People with Qs, people without Qs, people just looking for As without any Qs, people who are lost. You know, we'll accept anyone. We are not fussy. I say we, it's just me. I'm not fussy. Jackie's in the house. As always, good to see you, Jackie. How are you? Yeah, so without further ado, let's do this thing. I think it's working now. So I'm going to start off with this question here. Do you do skin whitening injections? What on earth are skin whitening injections? Well, I guess that answers the question. I don't know what skin whitening injections are. I mean, I know there's things like bleaching agents for hyperpigmentation, which we don't do. That would probably be more of a dermatologist. But injections, I didn't even know they existed. So that's probably answered the question there. No, we don't do skin whitening injections. So that would probably I'm guessing someone who's got sort of dark patches that they want lightened, which would be more of a dermatologist input than myself. So no, don't do that. So that's something there that you can get skin whitening injections. Why can't a keloid scar be excised completely? Well, it can, but I personally wouldn't. I think some people do. I think some people do excise keloid scars completely. The reason I don't, and a reason that's I think it's quite well accepted treatment for keloid scars, is to do an intralesional excision where you leave a rim of keloid, is because a keloid scar is a scar which has come from a small scar which we made bigger. That's one of the sort of landmark's the wrong word. Trademark? I think that's also the wrong word. Hallmark, I think probably is the right word. That's one of the hallmarks of keloid scars, that keloid scars are bigger than the original scar. So that's one of the distinctions between a keloid scar and a hypertrophic scar. So a keloid scar is bigger than the original scar. So typically you get a pinprick, so you get an ear piercing, or you get an insect bite, and you get a much larger, often quite florid reaction to that. So you get a much larger scar than the original scar. So then if we excise a keloid scar, which has gone from a pinprick to this keloid, and then we excise it and give you like a scar that's bigger than the original kind of pinprick piercing or whatever, and if that goes keloid, it goes even bigger than the first one. Does that, not sure if that makes sense, but it can, the risk of excising it, in fact, the risk of doing any surgery on a keloid scar is it can get worse. You can get a worse keloid scar. So that is the problem with keloid scars, and that's why excision really is a last ditch thing to do, only for really bad ones, because there is a risk of making it worse. And in order to reduce that risk of making it worse, you do what's called an intralesional excision. So you're cutting keloid scar, you're not cutting normal skin. So the scar that you're leaving behind is within the keloid, which you can then do steroid injections to try and get rid of that last rim of keloid. And it's kind of like a debulking of the keloid rather than an excision of the keloid. So the rationale being it's less likely to come back if you're cutting in keloid rather than cutting in normal skin. That's the rationale, but it's a tricky one, keloid scars. It's a tricky one to treat. What is the advice on having Botox? Should I avoid having any before surgery? If so, how long afterwards? I don't think there is any advice on having Botox before surgery, is there? I'm assuming that you've been given advice that you shouldn't have Botox before surgery. I don't think that's from me. Don't really ask people about their Botox history before doing surgery. So I've not got a problem with it. If there's some specific surgery or some specific advice you had, maybe come back at me with that or speak to the person who gave you that advice. But I don't think there is, as far as I'm aware, in my practice, I don't give anyone advice about not having Botox before surgery or after surgery. They can have Botox before and after surgery if they want. You can have Botox whenever you want. Got no advice on that one. Sorry if I've missed something there. Can I have a cyst removed on my forehead? I am 77 years old with type 2 diabetes and atrial fibrillation, for which I take Apixaban blood thinners. Well, yeah, you can. I mean, your risks are higher with those things. So the diabetes is increasing your risk of infection, wound healing problems. You're on the Apixaban for atrial fibrillation, which is thinning your blood, so it's stopping your blood clotting in your heart because your heart is fibrillating rather than pumping like that. It's kind of fibrillating, so the blood is potentially static in your heart. So there's a risk of it forming a clot and then can fly off and cause all sorts of havoc. So that means Apixaban is doing a good job stopping that blood from clotting. But when you have surgery, Apixaban will make you bleed. So that's the problem with Apixaban and surgery. My personal view on it is that the consequences of having a clot are more significant than the consequence of you bleeding from having your cyst removed. So I would say to you, I don't do anything particularly with the Apixaban, but I would say to you that your risk of bleeding is increased. So your risk of infection is increased and your risk of bleeding is increased. Infection makes it go red and angry, might make the scar not quite as good as we would like. Bleeding would make it maybe swell up and form a little bit of a bump, which might take a while to settle. And also, obviously, bleeding kind of down in your face is an issue. So it's a question of how much the cyst is bothering you, I guess. If the cyst is bothering you enough to warrant the risks of these things, you can have it done. But as I say, we would just talk to you about the risks and you would be able to weigh up those risks versus the benefits of having surgery. That's what it's all about. It doesn't matter, all operations, basically, that's what it comes down to, the risks versus the benefits. It's really up to you, and it depends on how much of a bad thing the cyst is causing. Is that worth it for the risks of having potential hematoma and or potential bleeding and potential infection of the wound? Yeah, so it needs a discussion, I guess, needs a bit of thought, maybe more so than someone else, because obviously most people would have the risk of it's not a risk, there will be a scar, which is what most people have to weigh up, whether the scar is preferable to the cyst. You've just got the scar plus these other extra risks, which everyone also has those risks, by the way, but your risks are high, your risks of infection and bleeding are higher than someone who hasn't got diabetes or is on Apixaban. I think I nailed that one. I have a mole located on my cheek below the eye. Will having it removed pull my skin down and make my eye disproportionate? Hope not. It depends on how big the mole is, depends on where the mole is. So, I mean, if it's a really big mole, yeah, it could pull your eyelid down and make your eye look disproportionate. But if it's not a really big mole, the answer to this one is send us a photo. Send us a photo. And we'll either go, blimey, that's a really big mole, that's going to pull your eye down and make it look disproportionate, or, it should be all right. What we try and do when we're taking things around the eye, you've got to be a bit careful with the lower eyelid. There's not quite as much spare skin in the lower eyelid as there is in the upper. So you have got to be careful, as you say, about pulling the eyelid down, pulling the lid off the globe of the eye, which means that the little tear duct pulls away from the eyeball, which means you can tear. It's called epiphora, especially when it's windy and things, it tears. So you've got to be really careful pulling too much skin away from the eyelid. So what we do is try and avoid taking things out in this direction and the lips that way. So we'll do it more in a side to side or oblique. Moles are often here. So you do it in oblique, so the pull is sideways rather than down. Yeah, so the pull is that way. You're pulling that way rather than that way. Do you get me? I think I demonstrate that quite well, actually. So we're pulling that way, pinching that way, rather than that way. We don't want to pinch that way, we want to pinch that way. You got me? So that's what we try and do with things around the eye. We try and do either an oblique or maybe maybe sort of horizontal, vertical, yeah, as opposed to horizontal. So yeah, so hard to say without seeing you, but in general terms, try and avoid that. And if that is a risk, then we'll try and sort of talk to you about that prior to having the mole removed. Go through that with you. And as I say, if it's a kind of normal size mole, usually we can do things without giving significant distortion or significant problems around the eye. Sometimes there's temporary problems, especially because of swelling and it feels a bit tight, so it might temporarily feel a bit tight and maybe even pull the eyelid off the globe. But then once the scar settles, it should settle. But as I say, we would certainly talk about that. And if you want to come to clinic, or if you want to just send us a photo before coming to clinic, that would be fine too. We can do that. Just send us a photo and we'll do that. Why don't you offer VASER liposuction? Well, because I'll tell you why. Because I'm kind of at the point where I can do things I use power assisted or suction assisted liposuction, also known as normal liposuction, just sort of normal, and I can pretty much do everything with that. I don't find any situations where I would feel that VASER would be beneficial. Now, I know people say that VASER causes some degree of skin retraction, so on the abdomen, on the arms, on places where I don't do liposuction, people do VASER liposuction, and I'll divert people towards those practitioners. I'm not sure. I'm not sure how much skin retraction it gives, so I'm not in a good position to kind of make a judgment on it. But my view is that I'm not sure if it's kind of like dramatic, the skin retraction it gives. So I still think that probably if you're going to have excess skin on your abdomen, on your arms or your thighs or whatever, then excising it is going to be better than VASER. And I think people do. VASER would agree with that. But I think the problem I've got with a lot of these things is it's often subtle, and I struggle with the subtle things, especially when they're expensive, because I struggle with having an unhappy patient. I don't want to have an unhappy patient. I fear that. So I don't do things where I am worried it might give a subtle result, especially if the thing is expensive, and stuff like VASER is expensive because the machine's expensive, so you have to charge a lot for it. And if it's not going to give really good results, I don't want to get into it. I know a lot of people do, so I guess it must give. I mean, normal liposuction gives good results. Whether it gives significantly better results than normal liposuction, I don't know. So I guess the answer is that, one, I'm not sure. I'm not saying it doesn't give really good results. I'm not sure if it gives some drastically better results than normal liposuction in terms of the skin retraction effect. Two is that I kind of, you'd have to buy the machines for capital outlay and train on it and all that sort of stuff. And I'm not in that arena. I'll be honest with you. I am in the arena of, I'm doing less now. I'm doing more minor ops, lumps, bumps, cysts, moles. You probably can tell by the sort of stuff I talk about here. I'm not doing so much of the breast and body contouring at all. So there's no way I'm going to look for more things to do and more, I'm not trying to build some big empire. If I was, I probably would look at doing that sort of stuff. So yeah, I guess that's also, it's probably, well, that's not, well, I've never done VASER, so I suppose I would have done it at the time when I did want to build an empire. But yeah, so I'm not doing so much of the sort of body contouring, breast surgery type stuff anymore. So that's kind of VASER liposuction would fit in with that. So I'm not. That's another reason why I'm not doing it. But I would say talk to someone who does it, because it's a very big business, and a lot of people do seem to do it. I think. Do they actually? I'm not sure, because people ask us to recommend someone. I'm actually not sure who to recommend because I don't know who does it. But I presume a lot of people do it. It's the kind of name everyone's heard of. So I'm presuming it must be good. You'd have thought so, wouldn't you? But look at someone who does it and gets good results. But yeah, leave me out. I'm not. I'm out. I'm out of the VASER liposuction stratosphere. Declaring myself out of that one. So yeah, crikey. So this FYI, and I know there's a legion of followers out there. I mean, they don't necessarily come on the live, but I know they're out there. I know you're out there. So in the next 2 weeks is Easter. So I want to wish you all a happy Easter, and also say that over the next 2 weeks I'm declaring myself out. So I'm out of the VASER Liposuction arena, and I'm also out of the next 2 weeks Q&A arena. So I'm declaring myself out of both of those things. So God only knows where that brings us. 22nd of April. So date in your diary, 22nd of April will be the next Q&A, unless it's not. But at the moment, it will be 22nd of April. So I will see you there. If you've got any questions, cue me, and I will do my level best to weigh them. And yeah. I'm just looking at the camera then. I've got a stain on my top, haven't I? Is that wheel or something? Anyway, so I will see you on the 22nd of April. This month, April. And I will, declare myself out. I don't know what's after Facebook. Facebook used to be low.